with Dr Marta Wereszka, and we're talking about lameness today. So, good morning, Marta. How are you going?
Good. How are you?
Yeah, good. Nice to see you.
Yeah.
Right, so we're going to talk about some lameness.
Sure. Yeah, let's do it.
Excellent. So, Marta, can you tell us a little bit about what horse owners could expect when they come to the University of Sydney for a lameness exam?
Sure. So, lameness obviously affects your horse's performance, and typically horses aren't performing at their most optimum level when they have a lameness problem. And so the aim is twofold. Firstly, what we aim to determine is where the source of the lameness problem is. So where is that pain originating from? And secondly, why? So what's happened in that specific area, whether or not it's arthritis or a stress fracture or a tendon or a ligament problem. There can be a number of different reasons why your horse is lame, and they're the two things that we want to determine. And then thirdly, obviously, to offer you a solution in order to resolve that lameness problem.
Okay, so Marta, how do you determine the difference between a forelimb lameness, a front leg lameness, and a hind limb lameness?
For a forelimb lameness, you want to watch the horse running towards you or trotting towards you. And what you're looking for is a head bob. And remember the phrase, down on sound. And so what happens is when the sound limb hits the ground, the horse will bob its head down. And so for the lame limb, the horse's head comes up. So you're looking for a head bob, and again, down on sound is the phrase you want to remember. For a hind limb, you want to watch the horse trotting away from you, and you're looking for an asymmetry, so a difference in the pelvic movement between the left and the right hind limb. So you're looking at the quarters and you're looking for a difference in up and down movement. Generally, when they're lame in a hind limb, they'll have more movement, more up and down movement in the lame limb.
Okay, so Marta, do you want to just take us through your approach to lameness?
Sure. So the first thing that I do is ask for a good history, so things like how long the horse has been lame for, what the horse is used for, the signalment of the horse, so the age, the breed. And while I'm asking all those questions, I generally take a look at the horse and assess for any obvious swellings, any obvious joint effusions, see if there's any obvious conformational problems, and work my way around the horse and also assess for things like muscle asymmetry. So anything that may give me a clue as to where the lameness may be originating from. So the second thing that I do is then have a thorough palpation of each limb, the back, the neck, and again I'm looking for any clues as to why the horse may be lame. So I start off by picking up the limb. So what we want to do is palpate the tendons, assess for any signs of pain or swelling. We look for joint flexion, any swelling that may be originating from the joints. And again, for any lumps and bumps which may not be normal and may be telling you that that could be the cause of the lameness. The next thing that I do is a hoof tester exam. So hoof testers are used specifically to see if there is a problem located in the foot. So what we do is we apply even pressure around the whole circumference of the foot, and you're looking for the horse withdrawing its limb, and that would be a positive hoof tester response that may reflect hoof soreness. As you can see, we're not getting any sort of a response from this horse, so this horse isn't foot sore. I gently tap it, and that would be a normal response.
So Marta, can you tell us what a flexion test is and why you do one?
Sure. So obviously a horse can't tell you where the pain is coming from when a horse is lame, and that's what we're trying to determine in a lameness exam. So flexion tests help us to localize where the pain is coming from in either the lower limb or the upper limb. And so we perform 2 flexion tests per limb. There's a lower limb flexion test and an upper limb flexion test. And we're looking for an exacerbation of the lameness. So let's say the horse is lame in the left front limb and we perform a lower limb flexion test. If we make the horse more lame or worse, then that's telling us that the lameness is likely to originate from the lower part of the limb, and that's the how specific a lameness a flexion test is. So it doesn't give us much more information than that. We then need to go on and do other tests to more specifically determine where the lameness is coming from.
Okay, great. Can you maybe show us how you go about doing a flexion test?
Sure. So for the forelimb, pick up the limb, and for a lower limb, we put the most pressure on the fetlock and the structures lower to that. So we apply pressure, typically for about 30 seconds, and then we trot the horse off.
Okay, so Marta, can you just tell me a little bit about when someone comes to the university and they find out their horse needs some sort of imaging, why that occurs and what's involved?
Okay, so when we've actually localised the lameness, so the source of the pain, to a specific area, sometimes that's obvious just on a palpation exam, but sometimes you need to perform things like nerve blocks and joint blocks to localise a lameness. So once it has been localised, then it's time to do diagnostic imaging. And so the most common methods we used in order to determine what exactly is the source of pain in the area that's been localised is radiographs and ultrasound. So radiographs are best for a bone problem or a joint problem, and ultrasonography is used if your vet suspects a soft tissue problem, so tendon or ligament problem. There are more sophisticated imaging techniques that are available that we do very often at the university, being bone scan and MRI as well.